And we are at the top of the hour, so we want to thank everybody who's joining us and say hello, good morning, or good afternoon, depending on when you got up. And you are at the right place to check out the roadmap to return to the workplace during this pandemic. And I am simply your MC today, and I'll be taking care of your questions and fielding answers. And I'll be turning it over right now to Brennan, who is the president and founder of Bright Talent. And as you probably know already, Bright Talent is the resource for strategic HR people, helping HR teams and business leaders solve people challenges. So one thing I just wanted to say before I hand it over to Brennan, when you have questions, if you could just stick that into the Q&A box and not the chat box, then we'll be sure to get them answered. Okay, take over, Brennan.
Thank you. And by the way, our lovely moderator's name is Mickey Jo Resto, and she is, I don't know if you said your name, Mickey Jo, so I'll do that. And she is our head of client engagement. And then we also have behind the scenes helping us, our head of operations, Renee Maurer, and and head of administration, Amy Watson. So without this team, this doesn't happen. So thank you. And thank you all for joining us. And really excited you're here. So either way, just thank you all for joining us. Bright Talent is a company that I developed after being an HR leader for the first half of my career. I developed this company 10 years ago to help HR leaders. And so I feel like this is an opportunity right now for us to reach out to our community, which has been so generous with us. We want to give back to you. And so this is just an extraordinary time as we work through this pandemic, as we work through as community, as professionals. And we really, as our team sees this, we see this as a change management project. So as soon as we kind of shook off the shock of the change, we started looking at how are we going to come back to the workplace. It's going to look very different than how we left the workplace. And we realized from our expertise, this is a change management project. We need to think this through as change, rapid change for the business, which means implementing new operations in terms of how we're going to be operating together and what is temporary versus what is long-term. So we're so glad you're here. We're so glad that you've joined us in the sense of learning about this together. And by the way, as I said before, we are experts in change management. We are not experts necessarily in how we're responding to this pandemic. However, we've become very proficient in learning from you and others in terms of how we should organize and plan to return our workforce to the workplace. So I just want to go over the agenda with you. And we're going to do just 10 seconds about us. Then we're going to talk about some assumptions right now in terms of what we could base our plans on. Then we'll talk about the planning that needs to go into it. We'll talk about the tools needed for this, and then we'll jump into our Q&A. So we're going to do about 20 minutes of just presentation, and then we'll do another 20 minutes or so of Q&A. And I'm really excited. We have Lorraine Sedlak, who is Director of Environmental Safety and Health and Sustainability for ITT Connect, their location here in Irvine, and we will introduce her towards the bottom here during the Q&A. And then we'll have a link for you of resources that you can go to as you develop this plan. So first, just quickly want to talk to you about us, just Bright Talent. We are a boutique HR consultancy. We provide responsive and resourceful experts in HR, project management, training, and talent acquisition. We are a company that operates by our values. We provide honest solutions. We do what's right. We're resourceful, accountable, and once again, we believe in our community, and we believe in giving back. And so in regards to talking about the roadmap to return to the workplace, a roadmap being we have a sequential process of how to do this, we're going to basically cover today, just talk about some assumptions, talk about the necessary project plan that needs to go into actually developing a plan to get your workforce back. And then we're going to talk about tools that you'll need to collaborate with other business leaders, because even though HR is in this extraordinary position of leading people and the people practices, we still need to partner with our peers in terms of the different functional or department heads. And then we're going to walk through some decision workflows, because as we think of our employee population, we're going to have different ways to think about it. One at a macro level by function, and then one at a micro level by individual employee. What we're not going to cover today is leaves of absences, emergency acts, compliance, or employment law. This is really more around operations and strategy. So then when we think about the assumptions, so when we talked about returning to the workplace, we started talking about this at the end of March, early April, and then now here we are. We are now starting to return to the workplace. Just like you, I'm reading the news every day. I'm very excited that our local parks now are going to be opening up with parking, and so it'll make it easier to get out into the trails. This is a great day. And so this also means other businesses are opening, and so we need to now put the necessary things in place. We need to be prepared. And so one of the key things that's important for you to know, no matter what is said at the federal, state, county level, ultimately it's your local city that will guide you in terms of what the guidance should be in terms of opening. So we will have some links for you to the local agencies at the end of this presentation, but that's important for you to know. So even if you're hearing other states are opening certain ways, it's not necessarily what's true in the particular city you're in. So make sure you're checking local agencies. And so when we talk about returning to the workplace, we need to prepare for several things. We don't know when this pandemic will end or if it will return. If we look at the Spanish flu of 1918, it actually had 3 different waves. So this is something where if we prepare now and then we seem to get back to a normal life, we can put some of these practices on the shelf, but be ready to bring them back out if needed, if we see a separate spike in the disease. Well, what this also did is it exposed gaps into our workforce plans. Many of us didn't have policies in place for remote working. So here's the opportunity for us to kind of get organized, or not kind of, but just to get organized in terms of moving forward so that we close any of those gaps that might have been in our policies. And it's also time to plan for this new reality where gathering restrictions, distancing restrictions, sanitation practices that are being ushered in now might be with us long term. So those are the things we have to prepare for. So here's the things to consider as we're building the plan. And I really narrowed it down to 6 things that we need to consider. One is distancing restrictions. So what office adjustments do we need to make to meet those distancing restrictions? Gathering restrictions in terms of we're used to multiple shifts, perhaps in production and manufacturing environments. We're not necessarily accustomed to shifts in the professional environment, in a professional office. So to match or meet some of those distancing restrictions and gathering restrictions, we might have to think about multiple shifts, having people come in different days or maybe different parts of the day. We also have to think about employee health restrictions. So if you are 65 plus or immune compromised, we really need to accommodate that group of employees. So we need to think that through. This is something we never had to really consider before. We also have to adopt employee health screening, meaning some kind of temperature and system checks. And this is what Mickey, Joe, and I were talking before we started the presentation. This is something that is very hot right now in the terms of the appropriate way to do temperature checks and symptom checks. And in the very least, you should be sending out a daily questionnaire if people are coming into the office as to how they're feeling, in the very least. And so that's something that is important to put into place. In regards to infection prevention measures, so if you have a situation where you have somebody test positive for COVID-19 and they're in your workplace, what is your infectious disease response and what is your sanitation plan? And then also, as I mentioned before, remote work policies. For those of us that didn't have them, we need to now put them in place. For those of us that have them, are they up to date? Are they still relevant with what's going on now? So these are some of the assumptions we have to work around. So if we look at this again as a change management initiative or a change management project, this is the way we have to think about it. You have to think about it in a project plan, and you have to categorically break out all the areas you need to work on to get detailed instructions of what you're going to do. So the ways that we thought about this, of how we would break this down into a really just a manageable project, right? Not, I guess that cliche, eating the elephant, not trying to eat the elephant in one bite, right? Breaking it down. that's a horrible analogy. I don't know why I use that, but either way, so I think you're getting my point. We need to break it down into categories that we could easily manage too. So one is we need to look at our policies. 2, we need to look at our communications. 3, we need to look by function. 4, we need to look by system requirements. 5, we need to look at our facilities. And then 6 means ongoing. How are we evaluating this on an ongoing basis? Right now, I'm learning a great deal about my own personal and professional development. I used to have to think things had to be perfect and polished, but right now, crude and effective are the motto of the day. We are putting practices in place that are more likely going to evolve with every week or every month. And so we can't get stuck on building things perfectly. Rather, it's crude and effective, and we're learning and we're adjusting with the flow of work and with the flow of guidance. And so the best way that we know how to develop a project plan is using MS Project. And so this is an MS Project Plan, Microsoft Project Software, Microsoft Project Plan. And for those of you unfamiliar with Microsoft Project Plan, it's a little bit like Excel, but far more robust when it comes to planning projects. So we have major tasks, minor tasks, primary tasks, subtasks. So in this case, we have developed this project plan, and it's going through those 6 categories that I just shared with you. And what I'm going to do, the next series of slides, I'm going to simply just walk you through what those categories look like in this project plan. And so first, we're going to start with policy. And so when we talk about policies, then the next subtask would be we need to draft or review your return to workplace policy. It is likely many of you don't have a return to workplace policy. We have return to work policies, but not return to workplace. So that's something new that we'll need to draft. And when I say draft, it's not going to be pretty. We're talking bullet points in terms of how you are bringing the workforce back to the workplace. And as you develop this plan, line 5 here, as I mentioned, you are not doing this alone. You are working with your peers. You're working with your business leaders together, and you're using this tool as a collaborative tool together to think through how are you building this plan to bring people back, starting with policies. What's the policy? What's the return to work policy that's already in place that you need to update? So you start with your policies, and then in parallel, and I realize I just contradicted myself, I said start, but communications has to happen at the same time as well. So when we look at the category of communications, it's very important that you build a communication plan. Your employees right now are looking for information. Just like us, they're reading everything that's coming out there, and it seems like there's a lot of contradictory information. So as an employer, we have to set a straight path through all the noise. And the way you're going to do that is through developing a communication plan. And you're going to develop a communication plan, which is going to develop a schedule. And you're going to develop that schedule around what is your audience and what audience of your employee base needs specific messages. And you'll be then drafting those messages by audience. And in some cases, audiences, all of the employees. And as you start building these policies and as you start putting new practices in place, one of the first communications that needs to go out is that you're doing just that. You are building policies and practices right now, and you're going to be communicating with them regularly. Even if you don't have necessarily things to give them yet, you're at least going to let them know it's work in progress. Because your employee base needs to know, what is my employer doing for my safety at work, for my health at work? What are they doing? So it's important to over-communicate than under-communicate. And so you will develop that project plan as it relates to how you're going to be rolling out these new practices. And then as mentioned before, we get down to functions, and you have to look by function, what are going to be the needs of the workforce as they come back into each department. As I mentioned, a professional office might have cubicles, and maybe there was a cubicle room, a room full of cubicles that you were fitting 40 people in, and they were less than 6 feet apart. It's possible that room can only now manage 20 people coming back to work because of the distancing requirements. So that's the kind of thoughtfulness and planning that has to go in with your department heads when we talk about facilities. I'm sorry, function by function. Then we talk about systems. So now what are the system requirements? It's possible your workforce now is going to work from home, and then they're going to come in occasionally. And when they come in occasionally, where are they sitting? That's called hoteling, when they're just popping in, they're working for a day there, then they're back to their home office. We have to think about what are the system requirements in that regard, what kind of station do they need to sit at, and what kind of requirements are those. And then we have to think about the system requirements for every single department. If you're in an engineering firm and you needed to work together as a team and now you're working remotely, what kind of system requirements is that to be able to work remotely in designing or building products? And then we move to facilities. Facilities is if you could see, it's a large part of this project plan. There's a lot to think about because we have to think about by location, by function, and then you have to narrow down by the rooms that people are meeting in, especially those communals like cafeteria, bathrooms, kitchens. Those areas have to really be thought about, and how many people can enter the kitchen at the same time. What are the sanitation products we have around? So the kitchen or the refrigerator door handle is being wiped down. So that kind of level of thought has to go into this. I'm really excited. Lorraine, at the end, towards our Q&A, will be talking about that in more detail. And then in terms of the very end, just ongoing. What are the things you need to think through ongoing? This is something you'll be evaluating probably daily, weekly, monthly, and you'll just be adjusting and communicating and adjusting and communicating as you go. And that's really what change management is about, is to communicate this until it gets into operations and everybody's operating a certain way. Okay, so one of the things that we need to think about is your employee population. So when we think about your employee population, we have to think of them at a macro level, so by function, and a micro level by employee. And so what we developed, the best way we can think of in terms of setting up change management plans and how you're going to manage your workforce is to develop a workflow. Now, I apologize. For those of you looking on a mobile device right now, this is probably very tiny. So I would say go to our website, go to the pandemic support page. There is a free download that you can open this and see it. In fact, all these templates I'm showing here are free for download on our website. And so in regards to this workflow, this is at the functional level. So just to walk you through the thought process here. So at a functional level, this is the functional workforce. The first question we have to ask ourselves, are they returning to the workplace or not? If they are not returning to the workplace, that means more than likely they are a remote employee. And if they're a remote employee, the next question is, are they on leave or not? Are they sick, or are they caring for a sick household, or maybe it's impossible for them to work because their kids are home from school? So what's happening here? Even though they're a remote employee, they can work. Are they on leave would be the next question. Then we just go into our leave policies. But if they are not on leave and they're able to work remotely, then they're going to continue to work remotely, and we're going to review and update our policies. And the question there is, do we need to draft or update or communicate anything to that remote workforce about any updates? So of course, then we would update them, and then we'd come back here and we would continually evaluate this policy, as I mentioned before. And of course, then it continues the cycle to continue to update your employee base about any changes. If we come back to the top, again, the functional workforce, return to workplace, yes. So now we have a workplace employee, and that workplace employee is coming back to the workplace. So again, is this person on leave or not? If so, then follow your leave policy. If not, they're coming back to the workplace, and then we need to figure out what are those requirements. So we have this sub box, which is exactly what I just shared with you in our project plan, who you're going to be communicating with, who you're going to be working with, the department heads, facilities, to make sure that you have all the requirements laid out for that employee coming back to the workplace. And here's a little tip. And when we first built these 4 weeks ago, it was somewhat novel, not now, but as a tip, workplace supplies include cleansers, sanitizers, face masks. These are all necessary PPE to provide your employees that are coming back to the workplace. It could be deemed that at least a face mask is necessary because of wage and hour laws based upon where we're at in this pandemic. However, it is a perception of practice that you're caring for your employees that you want to provide this. And so once we get the requirements in place, we communicate that requirements with the employee and how they should be operating. And then we have, again, ongoing evaluations, and we start this cycle over how we're evaluating. So that's what it looks like in terms of a workflow and segmenting your population by function. What does it look like by employee? So when we look at an employee workflow, the first question we have to ask, are they able to work? And if they're not, then you're moving to your leave policies. The next question is, if they're able to work, yes, then the question is, do they return to the workplace? If they return to the workplace, we're saying yes, return to the workplace, and you're going to be going through the same workflow that I just talked to you about in the functional flow of just giving them requirements and such. If they're not returning to the workplace, are they able to work remote? If the answer is yes, then you're working through the same workflow I just showed you on the functional workplace or functional level, so you can see how you are going to be managing your staff through the remote piece. The challenge is, if they are not returning to the workplace and they can't work remotely, what are we going to do with them? So we have to evaluate the employee status. Are we going to change their job so that they can work remotely? And if they are, then we have to kind of go through that process to configure out exactly what kind of job they're in. If it's not possible to change their job, and it's not possible for them to work remotely or in the workplace, then we have a challenge right in front of us. Is this a position, is this a person that's going to go on longer leave, disability? Is this a person that's going to be furloughed, possibly laid off? So those are the decisions that we need to continue to make as we evaluate not just the return to the workplace, obviously the overall economic situation moving forward. So that's the workflow as it relates to employee-centric and managing those employees. And then the next document we have is what we call the project plan outline. This is in support of the project plan, and it includes links to resources for up-to-date information. So I'm not going to walk through this because more or less it details what I just walked you through in the project plan, and this is free for download on our website as well. But what we did is we embedded the necessary links that we feel you will need as you go through this and develop your own plan. These are the links you will need to develop your policy and your practice. And so now we move to the Q&A. And so just want to point out here, I've got links to all these different governmental agencies and resources. I have a link to SHRM. I have a link to our website where we've consolidated a lot of resources for you, as well as Casco Back to Work, which really is a commercial construction company, and they give you really good free information as it relates to what to do from a facility standpoint. And then Fisher Phillips, who's our partners, employment law, they have a wonderful post-pandemic FAQs. They've got the health check survey that you probably want if you haven't created one. So that's a great resource as well. So we will now move to Q&A. And I don't see, Mickey Jo, are you still with us?
Yes,
hello.
Of course. Hi. Let's see. We have a couple of really good questions here. The first one is, if one of our employees is quarantined, what information can we share with our other employees?
Well, there's a series of guidelines, and I'll direct you to that Fisher Phillips link there that does a very good job listing how you will handle this. In short, you have to understand if that employee tested positive and they were in your workplace, you have to more or less backtrack who was within 6 feet of them during their time in the workplace. And then you're going to let those people know that they've been exposed. And so then you would need to quarantine those people for a period of time. The person that tests positive has to be quarantined for a minimum of 2 weeks, and of course, free of symptoms and such. Was that the question, or was it if an employee is in quarantine because they were tested, what can we communicate to others? I would say those that were within proximity of that person will be contacted and let them know that they were potentially exposed and they too need to go in quarantine.
Yeah, and then I think you need, the company will have to really think about what they share, what they communicate with anybody else in the department, depending on how big the department is, how big the area is.
Correct.
Yeah, and that's a big conversation from company to company. I don't think there's any great guidelines specifically that you can follow right now. We're all discovering that together.
Right. What you will not do is publish that person's name saying this person tested positive. We will not do that. So it's something that If you feel the entire office needs to know that someone did test positive and that you are quarantining anyone that was in proximity and that you also sanitize the entire facility that they were in, that's okay in terms of letting the employee base know, because you're showing transparency. You're also showing that the company is responding appropriately in terms of how they're handling it to mitigate that. And Lorraine, when Lorraine comes on, that's maybe a question she could also respond to as well.
Yeah, and HIPAA rules still apply. So.
Correct.
Yeah. And then the second one is, this is really good. Does contracting COVID-19 constitute having a disability under the ADA?
You know what? I'm going to punt that specific question as it relates to ADA because I think our employment attorney would better respond to it. But my understanding right now, if COVID-19 is, at least for this period until July, seen as a workplace injury, and depending on the potential effects of that injury to that employee, then we could potentially go from short-term to long-term disability. But again, this is a moving target. But I would say if that COVID-19 causes long-term effects, then the common sense and the answer would be yes, that becomes a disability.
Yeah, and I'll just say that I was looking up some links on that while you were speaking. That's one reason I was off camera.
Thank you.
And I'll say that I did send a link, and I can send this link to everybody who's on this call and make sure it's in our follow-up email as well. But it's still a little bit vague even on what the ADA says. They basically say that the ADA and Rehabilitation Act rules continue to apply to COVID-19, but they do not interfere with or prevent employers from following the guidelines and suggestions made by the CDC about steps employers should take regarding the coronavirus, and also the EEOC guidance. So they're kind of all referring to each other.
So let's what I do know, so let's flip that question now. So if someone has been positive with COVID-19, and let's say for a variety of reasons they couldn't come back to work in a time frame that was suitable for them or the employer, and they are laid off or they begin looking for another job, currently EEOC says in a hiring process, you can ask someone if they have tested positive for COVID-19 or what kind of symptoms they might be having now. So we're in this really interesting time frame, and that's part of the reason I'm not comfortable saying is it ADA or not. What I'm going from a perspective of just trying to be as commonsensical as possible. So COVID-19 is the disease, but if that causes a long-term health effect in somebody, that switches to a disability. And so that's something that I think is going to be individually looked at each time. But if the person asking the question, if you have access to an employment attorney, I would advise you to go there as well, just to confirm anything we're saying here.
Absolutely. I think now's probably a good time to go over to Lorraine. Would you like to introduce her?
Awesome. Yeah. So while I introduce her, you can bring her up. So really excited. As I mentioned before, Renee Maurer, who's head of operations with Bright Talent, and myself, we worked with Lorraine Sedlak when we worked together at Black & Decker. And Lorraine was our director of environmental health and safety. And I'll just tee it up this way. Lorraine was highly respected in the organization because of her depth of knowledge as it related to environmental health and safety. And Lorraine just isn't knowledgeable. Lorraine has that profile that you want to see in an environmental health and safety expert because her level of detail is remarkable. When you went with a question to Lorraine, the response was typically not just the response you thought you were looking for. She gave you all the other variables surrounding that response that you didn't even think to think of. So as I said, as this webinar has evolved and we're putting processes in place, and this has become really largely an environmental health and safety initiative for most companies, Lorraine's name, of course, came to me, and I caught up with Lorraine, and she was so kind to agree to come speak to us. And specifically, we will, and I guess we could turn her off of mute now, Mickey Jo.
I think she's muted from her side. Yeah.
Oh, okay. Okay, and so specifically, she developed this amazing tool, this risk mitigation tool that she was going to provide her managers so that her managers by location are organized in all of the practices they are putting in place to mitigate the risk of COVID-19 being realized in their workplace facility. So with that, Lorraine, thank you so much for joining us. It's so exciting to have you here. And maybe just start by sharing a little bit about your current scope, and then maybe talk a little bit about some of these tools you are putting in place. And I notice you are on mute right now, so I don't know if you accidentally put yourself on mute.
Yes, Lorraine, I've tried to unmute you from over here. I've allowed you to talk, and then I've tried to unmute you, and it's not unmuting, so I'm thinking you're muted from your side. She and I are both probably pressing unmute at the same time.
I know, right? At the same time.
Yeah.
So what? Also, Renee, if you'd like, give Lorraine a call, and maybe she could also dial in too if for some reason the actual Zoom functionality is not working. And so while we're trying to get her connected, I will say that most organizations are building there she is. I think she's off. Lorraine?
Hi, Lorraine. I switched you to a panelist, and now it looks like you can speak, but we can't hear you.
Maybe her speaker on her computer was turned off.
Yeah.
Okay, so as Lorraine, just chime in as soon as we can't hear you right this second still. And perhaps Renee's going to help get the audio phone.
You know, here's another question that we can talk about while Lorraine is trying to navigate. So, and this is funny because we were just talking about this too. At the start of the day or shift, do you recommend having a checkpoint off-site in front of the office doors or just inside? If inside, how far would you allow people to walk in to get screened?
That's a great question, and we've been talking about that now for even since last webinar. So let me just answer it this way. It completely depends on your office configuration. It depends on how many employees you have coming in at a time. It depends on the technical capabilities of your employees being at home, if they're able to be on a video call or a phone call to ask them to go through an employee health check. So the first thing you need to know is, especially with this workers' comp executive order that came out last week by the governor of California, COVID-19 can now be deemed a workplace injury. And so if somebody comes with COVID-19, the first thinking is that if a person's coming to work, is that it was contracted at work. And so employers can rebut that, but you only can rebut it if you have a process in place. And the process doesn't have to be overly complicated. The process can simply be, you have a health check questionnaire that you are providing your employees, and you could either be doing that through email and them responding to you. You could do this through video chat. You could do this through a phone call, asking them the questions. As you need to have that process, though, asking those questions as to whether or not they have symptoms and if they have a fever. And so that's starting at the home level, which I would highly recommend. At the office level, you have to think this through. You have to have designated staff that are going to be health checking people, and your staff have to be protected from employee checking in terms of actual protective equipment. So at minimum, they need to have the medical grade N95 mask. They need to have gloves. But then it's also recommended to have a face shield and a gown when they are doing the health checks. Health checks consist of probably taking a thermal temperature check, and they're going to have a clipboard that they're keeping track of. If the person is negative, you're not necessarily keeping track of that. If a person's positive in any of the symptoms, then you're going to keep track of that, and you're going to send that person home. And so once everybody's been checked that's coming into the workplace, you should have a sticker, like an I voted type sticker. You should have a sticker that they would put on them, or a rubber wristband, so that you know anyone in the workplace has been checked for that day. And so that's the process, or the level of detail I've seen others go through. And so as it relates to being inside or outside, here's one of the, I think, the trickier questions for all of us. So there's no HIPAA issue when you're checking until somebody says yes to a symptom. And so when you are surveying the employees one-to-one, you need to be not within earshot of each other when you're asking, because if they say yes, now it's a HIPAA privacy claim or issue. And then I don't know how to solve this. Then you have to somehow figure out sending the person, if they've said yes, they have to go out and leave to go back home. But somehow you have to protect their rights from the other employees that are witnessing this. So I'm not quite sure how that works. But I think half the battle is putting a process in place, making it consistent so there's no discrimination. And then what you would do is then have employees that have been checked come in, obviously, through the process. So that's kind of a little bit of a stickler. I'm a fan, if possible, of doing it from remote. That way the employee's not even coming in into the workplace. So that's a long answer because there's many variables to it, and hopefully I answered as simply as possible.
Yeah, that can, just a simple question these days can have a lot of moving parts.
Correct.
Unfortunately, it looks like we lost Lorraine for the moment. I don't know if she's trying to get back in. Let's see. Renee, I'm trying to unmute you as well.
We're having some technical difficulties. So what I will share with everybody on the call is what Lorraine was going to look through, and we're going to have her back next week. And I apologize to everybody for the technical challenge we've had, and live and die by technology. What Lorraine had created, so many of us are building playbooks of what to do, and it's a more or less of a flow and a process of what to do, and a playbook is written somewhat bullet point and narrative in terms of how you are organizing your workplace, how you're sanitizing your workplace. And so what Lorraine had done is built this spreadsheet that took that playbook, that narrative, and dropped it into a check mark process. Very organized, very in-depth, for managers to use on a daily basis as they walk the floor of their facility, as they're talking to the employee base. And we have a version of that. So for all of you that are on this webinar, please email us either at hello@brighttalent.com, or, sorry, I advanced that one too, or you can go to our website and contact us through the contact form. We will provide that tool for you because it's highly detailed. It's very comprehensive. It actually gives instructions on how to clean. And I didn't know this, but when you spray cleanser on a surface, you have to let it sit there for 20 seconds and then come back and clean it again to wipe it down. That was new to me. So things like that.
Brennan, that's the same for your hands too. When you're washing your hands, you should do it for 20 seconds.
By the way, I was guilty. I'd never washed my hands the right way for most of my life. Now I am. So very, very true. So 20 seconds, but that level of detail in that plan. So for those of you on the webinar right now, please contact us and we will get a version of that to you.
Okay. So I just got a note that says Lorraine is on.
Oh.
And let's see. It says Lorraine is on the call.
Maybe she dialed in.
Yeah, but I don't see her connected.
You see just a phone number?
I do. I'll try that.
Oh, there you go.
Ah, I'm unmuted now?
Yes.
Yes. Awesome.
Yay. Okay. Sorry about that. I hate technical difficulties.
That's okay. Lorraine, thank you so much.
You're welcome. I actually was let me open a document up I can walk you through, but I did want to go a little bit through our journey that we went through,
Okay.
but let me open up what we've developed. It's actually a tool that was taken out of the GM's website. They have a back to work document. It's a really good document. I think I may have sent that to you already.
You did. You did.
So give me 1 second. I got to open something up, and it's giving me a checklist. Okay. I'm going to just start talking a little about the journey we went through. Then I can give you a bit of a feel for why we are where we are today. And I wanted to start out with just supporting and thanking Brennan for asking me to speak, supporting the premise that this is a collaborative effort that requires EHS, legal, and human resources. And as an EHS professional, I have to tell you guys, this is the first time in my career that I ever thought that the words PPE and N95 would become a household item. So
right.
It's been really exciting. I'm going to talk a little bit first about what we did, and then I'll get into the checklist very quickly. One of the things we at ITT had the advantage of, or disadvantage, was this: we have operations in China. And I have a plant in Shenzhen that was heavily impacted by the COVID virus. We had what I'll call a double whammy. First, we had the New Year's holiday where everybody had gone home, and a lot of our employees are, we actually have on-house dormitories because we have a transient workforce. They went home, and guess where they went home to? The Hubei province. So we found that we had two things going on. The Chinese government shut down the Hubei province, and our employees who were visiting family and friends were unable to get back to work. When they did open up the province, the employees were required by the Shenzhen government to go through another 14 days of quarantine. And in that process, the Chinese government did not allow us to open back up until we implemented a lot of these things that we're talking about. And I'll just go through the checklist that we have. One of the things the checklist talks about is if I'm at a site, what are the things I need to make sure I've taken care of? And I know that Brennan has talked about some of them. Face masks. Let me talk to you about the journey of face masks. For those of you who have tried to get surgical face masks, you know that there has been what I call a lot of profiteering going on. I've seen the prices go from $1.41 to as low as 60 cents within a matter of weeks. But we could not initially get any face masks. So what we did is we had our Chinese partners send them to us. We also found out one thing that we're still struggling with, just to let you know, and is on the checklist, is the critical supplies, the N95. What the CDC recommends and how this relates to you as a business is, in theory, anybody taking temperatures with a handheld thermometer should be wearing an N95. Try getting those. It is close to impossible. So what we're doing instead is giving them face masks and face shields, putting them in gloves, and having them take employee temperatures. So the next thing, and this became a part of a lot of what you're seeing going on in the COVID world, is basically taking a page out of what the Chinese government required, and we're adopting it pretty much worldwide. The next thing was temperature screening devices. And this is on our checklist as well. And what we found was, at first we said, oh, we'll just go order all of these thermal thermometers that you would use for checking a child's temperature. Well, what you found out very quickly is that Amazon would say they'd have them, but they didn't. They would be back ordered. We got a few just before the back ordering started. And again, we reached back out to our Chinese affiliates, and we were able to get thermometers. The problem is the instructions were in Chinese, so we had to get those interpreted. But we also found out you've got to be very careful when you buy a thermometer, is that some of them, if you read carefully, say you're supposed to touch the forehead, and we didn't want that. So we had to go back and find thermometers where I could at least be 1.5 to 2 inches away, and we would be able to do temperature screening. Now, the next thing that was asked of me was to look at are there other ways to take temperatures? And we looked at the use of infrared cameras. And I have to tell you, the first thing about infrared cameras is everybody's jumping into this space. And you have to be extremely careful when you are looking at infrared cameras. It is definitely a seller's market, but there are two separate technologies out there. One is a technology that measures temperature at the corner of the eye, and these cameras comply with an ISO standard for measuring human temperature. The second technology is the one that is your infrared cameras. Now, the infrared camera technology has been around for a long time to measure equipment. You do it when you're looking at whether our electrical systems are overheating or our machine motors overheating. It's been in the petroleum and gas industries for centuries. But they are now repurposing it for human temperature. Now, what you need to be aware of is when you measure skin temperature, you have a higher degree of variability, and if you read the literature very, very carefully, it says that you have to verify using another method of accuracy if you get an elevated temperature, such as a oral thermometer and other type of thermometers, which would cause human resources issues, obviously. But what we're finding is that one size doesn't fit all, and we are using in one location the thermal cameras. What you're finding, we're using the ones that meet the ISO standard, but when you do that, the other thing you find out about thermal cameras, because everybody's selling them to you, is you got to be very careful about windows and reflective surfaces. Where we put the thermal cameras in my Nogales operation, we have two sets of glass doors that enter into a long corridor, and then in front of the next set of double glass doors is our metal detectors. And in the evening hours and the early morning hours, the cameras work wonderfully. But then you find out that when the sun rises and the doors are open, the cameras don't work. So we had to work on fixing that, creating a screen so it would work. It works very well. It's the real beauty of it is I can have monitors well past the 6-foot social distancing, so I don't really have to put people in PPE. I just need someone to be monitoring that. So as a business, you need some way to measure temperatures. I think this is the new normal. Whether we like it or not, we're going to be doing it. And the next thing we have on our critical supply management checklist is hand sanitizers and sanitary wipes or disinfecting wipes. And as Brennan mentioned, getting hand sanitizers is one thing. The market's starting to open up. We're able to get them. The disinfecting wipes is something like the early months of toilet paper are very hard to find. So we're really going back to using good old-fashioned bleach. And one of the things I was asked to develop was a procedure for cleaning the workplace. And in particular, we're looking now, hopefully, at a return-to-work scenario. So I was asked, and I created, based on CDC guidance, GM's playbook, and Lear's playbook, I developed 3 categories. I had to develop a daily disinfection of commonly touched surfaces and frequency in production and offices. Category 2, periodic thorough cleaning, which is what we're going to be doing before we step back to work. We're fortunate a lot of our businesses are considered essential, a lot of our operations, so we've had employees working, but we still, like everybody else, put a large, wherever we could, we have employees working remotely. Well, we're starting to bring them back, so that's why we need to do the periodic and thorough cleaning. The last category, which is the one, is the cleaning and disinfecting the area where an active employee has been identified. So that one is obviously a much more thorough cleaning. It's what you do if somebody tests positive in the workplace. And it really is written such that we need to have a discussion. If we have someone that's presumed to be positive, do we go to that higher level of cleaning? And that's going to be based on discussions and agreement with our leadership team. So As an EHS professional, I'm finding myself getting into areas that I never thought I would get before. And then cleaning supplies. You need to make sure that you have the cleaning supplies. What we're working on right now is developing things like little cleaning kiosks that'll have a spray bottle of bleach or whatever disinfectant we can get, some gloves, and towels. And we're going to encourage our employees in meeting rooms after the end of a meeting, using social distancing if we are meeting face-to-face, clean up afterwards. We talked yesterday about everybody loves to have a potluck. We're going to have to end the potlucks. And if we're going to have any type of food events, we're going to end up having them bring in boxed lunches. It can be separate, clean. You're not worrying about people handling common utensils. So that's also another thing we looked at. The other thing we talk about is in this checklist, it goes through an owner, an overall status, and notes, and who is responsible, whether it's a site owner, facilities, safety, security, whomever. Then the second thing that I really like, and again, this is taken out of other playbooks, is they're doing a COVID-19, lack of a better term, safe observation. For those of you who have done BBS, it's similar to that. But what it forces you to do is it forces our managers, our supervisors to get out on the floor and validate that our employees are following social distancing, that they are keeping their workplace clean, that they understand how to use a face mask, that they're wearing it properly. And this does a couple things. Number one, it forces a lead by example mentality. If we expect our employees to be wearing face masks, we need to make sure that we're wearing them when we go out there. And it also reinforces the importance of social distancing, hand washing, disinfecting, wearing your mask. So I really like that process, and this is something we want to deploy. But it also is a good check and adjust. The other thing, I was sitting in on a conference offered by the Department of Defense, and one of the things that the chief security officer for Coca-Cola talked about, and this is a question from a human resources standpoint that we have to get tough on. What she said was very eye-opening to me was she said, we're getting employees, they're going to start holding other employees accountable because they're afraid. They're wearing their masks. They want their fellow employees to be wearing their masks. They want them to be wearing it properly because they may have somebody at home that is immunocompromised. They may have infants at home. They themselves may be worried about their own safety. So if we don't, as leaders, start enforcing this mandate, the employees will, and what she says, we may see some bad behaviors exhibited. So for those in the HR world on this call, I strongly recommend that you sit down and you figure out exactly what you're going to do if somebody refuses to wear a mask or continuously doesn't wear their mask or wears it inappropriately. So that's one of the lessons learned that I'm taking away, and I think is very important from a human resources standpoint. And with EHS, the other thing that I really recommend is you sit down and have a systematic approach to when are masks really required in the workplace. If I'm sitting in my office with a closed door, do I need to be wearing a mask? From a practical standpoint, probably not. But if somebody comes into my office, yes. If I'm in a cubicle and there's nobody around me, let's think from a practical standpoint, what is your policy and your direction going to be so we can make sure we keep our employees safe? But what I'm hearing the most from my team is employees say they're hot, they're bothering me, they're not wearing them properly, and we're coaching the best we can, but at some point in time, it's got to become a real thing. So the other thing I have on this checklist that has been put together is disinfecting common touch points, how you disinfect, what PPE you wear. Some people put signs saying this area has been recently disinfected, but it walks through here's the processes you need to go through, and it's very prescriptive. It talks about touch points, sanitation tools and stations, mobile equipment. If you think about the workplace, are you sharing forklifts? Are you sharing trays when you move your product from workstation to workstation? How are you going to clean these? How often are you going to clean them? Who's going to clean them? One of the things you're going to find out is your employees are going to have to help you. There's not enough janitorial staff in the world to be cleaning all your common touch points or to be cleaning their workstations. And then finally, we talk about in this spreadsheet, we talk about what are you going to do about truck drivers? What are you going to do about, are you going to let them onto your premises? If so, are you going to take their temperatures? What are you going to do about material handling equipment? How are you going to handle all this? So those are a couple of things that we've gone through, and I'm telling you, this is an iterative process. It does not, you're constantly learning, and as Brennan said, is don't try to be perfect. You're never going to get there. And let your employees know that. Let you know we're all learning at the same time. We all want to keep our employees safe. And I think the biggest lesson learned I got out of all of this was I tend to take a very pragmatic approach to everything and try to problem solve. I was trying to solve the problem, not understanding that our employees were scared, and some of them continue to be scared. So, and the TV doesn't help, social media doesn't help. So we need to make sure, to Brennan's point earlier, you cannot over-communicate. But the most important communication that we have done is we are doing these things to protect you. We want you to be able to work. So please, please integrate your health and safety and your human resources and your communications surrounding and understanding that there still are employees that are extremely worried about themselves or their families. So we need to help them work safe, work confidently, and believe that we are doing everything we can to keep the workplace safe. So again, Brennan, I thank you. Hopefully you could hear me, and hopefully I didn't overstay my welcome. So I will end with thank you very much, guys.
Well, Lorraine, can you hear me?
Yes.
Okay, good. Well, first of all, thank you for powering through the technical difficulty and coming back on. I was really appreciative of that. I know that gets a little frustrating when you're ready to go and it doesn't work, so thank you. And just secondly, that was a wealth of information. And again, I looked at that document you created, and you and I, even in the short period of time we reconnected, we've been collaborating, which is great, just kind of cross-examining each other's notes and things. And I think that's the important takeaway here too for everybody on the call. Talk to others. We're all learning. We're all in this. It's been unbelievable how everybody's willing to share with each other, because like I said, some people are doing some things well, other people are doing other things well, so it's kind of nice to get together and learn on the fly from one another. Mickey Jo, do you have any questions that have come up for her?
No questions, but I just wanted to say personally to Lorraine how much I admire and impressed with not only the detailed thought and analysis that you put into your document, because I also saw it, but just the level of caring that I hear that, yes, showed up in that level of detail, but, you know, not just caring about your expertise and profession, but really caring about the United States workplace at large. I really see that. It's really come through, and I just want to thank you for that.
You're welcome.
So with that, we're right just about, we ran a little long, but that was to accommodate the technical difficulties, but we're right on the dot here about noon. So just want to thank all of our attendees for joining us. Thanks for your patience in working through the technical difficulties. We're going to be back here next Friday, and we're going to be talking about everything that Lorraine just talked about in terms of the health process, but we're going to also talk about just the employee wellness. How are they faring through all of this? How is their mental health? Lorraine just talked about being scared. Well, being scared sometimes means you're not sleeping at night. Now you're affecting your personal health. So we're going to talk about how do we help our employees navigate those challenges that are even out of the workplace, right, as we go through this pandemic, because ultimately that still affects them as they come into the workplace. So thank you, everybody, for attending. Lorraine, thank you. You were just awesome. I just am so grateful for you being here. Everybody have a great and safe and healthy weekend. A reminder for those of you in Southern California, the Blue Angels are flying over starting at about 1:45 today. So don't forget that. That's going to be in celebration of our first responders who are putting themselves out there. So take a minute to look above about that time to enjoy it. And just everybody, thanks again and have a great weekend.
Thank you. Bye-bye.
Bye.
Bye-bye.